Okay, so today we have Alberto Giubilini, who is Senior Research Fellow at the Uehiro Center for Practical Ethics. And he'll be talking about the ethics of restricting freedom in public health policy. So there'll be a 30-minute presentation, and then there'll be 15 minutes time for questions. You can either ask questions by raising your hand, or you can also ask a question in the chat. It's up to you. I'm just, because Alberto had some problems trying to share his presentation, so I'm just gonna try to share his presentation, and I'll try to move the slide. So let me see whether this works.
Yeah, so thank you, Katrina. I can see the slides.
Can you see it, or is it in presentation mode, or?
No, it's not in presentation mode yet. Now it is.
Okay, so just let me know if I need to change them. That's fine.
Thank you. So thank you, Katrina, and welcome everyone. I apologize for this technical issue, which means that I will have to repeatedly say something like, please click, or please to Katrina, which might sound a bit disruptive. Also because some slides are in the animation mode, so I will need to, but we will get through it. So I apologize for that, and thank you, Katrina. So can you see the presentation? Can you see me? Can you see both? Yeah, good. Okay, thank you. So yeah, let's stay there for a bit. So we're going to talk today a bit about the ethics of restricting freedom in public health policy. That's the title of the presentation. And a good way to start, as the next slide will show, is about asking this basic question. So if you can go to the next slide, please. So the basic question is, what is freedom? That seems to be a good starting point. And well, spoiler alert, the answer is, I don't know. And you will not have an answer to this question by the end of the presentation. So I was saying, the reason to start from this question is that we all have some kind of understanding of what freedom is, but there are really different understandings of freedom that are involved in this issue of freedom in public health restrictions. So the first thing to do is try to confuse a bit your ideas about freedom, and then we try to see whether from that confusion something useful can be derived. So if you can click on the next slide, Katrin, please. So a good way to start to me is this dialogue that refers to the political context in which this was this comes from is not relevant. So we have two people, and the first person asks the second, "Must be so terrible for you not having freedom of speech." And the second replies, "But we do have freedom of speech." "What do you mean?" "Well, you're free to say absolutely anything we like. The only difference is that we don't have freedom after speech." So this is an interesting use of the notion of freedom of speech, because literally this is true. It's not the way we would think of freedom of speech normally. Or another example, Katrin, please, next point, is this sign that you can easily find everywhere in cities. So this sign clearly says that it is prohibited to park your car somewhere. So in a way, you don't have the freedom to park. But next slide, please. Next point, please. Of course, everyone does that all the time, and people simply hope to get away with that. So if you can click twice, Katrin, please. So the question here is, do you have freedom of speech in the case, in the first case? And are you free to park your car in the second case? So it seems that in one sense, no, you're not, but in a sense you obviously are, because the option is there. I'm going to focus on public health policy, and specifically on infectious disease policies, mostly because that's our most recent relevant experience with pandemic policies. But when we talk about the tension between individual freedom and public health, of course, this applies to many other public policies. So, for example, climate policy. Europe, for example, is now banning short flights, but there is a push from some activist organization to prohibit even longer flights. Lifestyle choice policy as well. For example, you might have heard that New Zealand is going to ban smoking for young people from 2026. So it will be a crime in that country to smoke a cigarette for those turning 18 after 2026. So these are both instances of a more general problem, which is a limitation of individual freedom for the sake of public health. Now, in liberal societies, when it comes to limitation of individual freedoms, one principle that is widely acknowledged and widely applied is some version of what is known as the harm principle, famously formulated by John Stuart Mill. And you might have heard a version of this before. It is worth reading it again, although most of you will be, no, sorry, can you go back, please? Most of you will be familiar with that. So the principle says that the only purpose for which power can be rightfully exercised over any member of civilized community against his will is to prevent harm to others. His own good, either physical or moral, is not a sufficient warrant. Now, this is the rationale behind justified limitation of freedom in liberal societies. So I was, okay, let's start again.
Okay.
So I gave you these two examples from an hypothetical dialogue, a sign of no parking, you might remember, just to see that the way we use the notion of freedom, is different. Freedom can have different meanings. And then I was explaining how I'm going to focus primarily on public health policy and infectious disease policies. But here there is a more general problem in public health policy of this tension between individual freedom on one side and public health good on the other. And I gave the example of climate policies or some kind of policies like smoking bans in New Zealand. So it's the same kind of tension at stake. But I will be focusing on infectious disease and I will mention COVID simply because that's our most recent and most relevant experience from the last couple of years. And the point I was making is that generally in liberal societies, when it comes to not only to public health policy, but to public policy more generally, the widespread assumption is that freedom can be restricted permissibly according to what is known as the harm principle, or some version of the harm principle that was formulated by John Stuart Mill. And the principle, which many of you might know, but it is worth reading again. So the only purpose for which power can be rightfully exercised over any member of a civilized community against his will is to prevent harm to others. His own good, either physical or moral, is not a sufficient warrant. So this to me seems to be the justification for freedom restrictions in liberal societies. Now, importantly, when John Stuart Mill talks about harm, he refers to something more specific than what we might think by harm. So he refers to the violation of such significant interest over which one has a right. For example, a right to health. And this is because if you think about it, everything we do comes with some risk of harm to other people, but it is not a sufficient reason to restrict freedoms. For example, me driving a car comes with some risk of harm to others. But Mill says it's only when there is some significant interest over which one has a right that is threatened by my behavior that the state can permissibly restrict my behavior. So one may think, for example, a right to health. If my behavior threatens significantly someone else's health, then the state might have some liberal justification for intervening. So if we move to the next slide, please. I feel like you remember the press conference from the government when Chris Whitty was speaking and kept saying this, next slides, please. So I will be doing a bit of the same thing. No, come back, please. Yeah, thank you. So one problem with that harm principle is a proper problem of proportionality. So the idea is that you want to restrict freedom when there is some significant harm in my behavior, harm posed to others. But I mean, the restriction needs to be proportionate. And the question is, when is the restriction proportionate to the threat of harm? One problem in answering this question is that when we assess freedom, individual freedom versus health, the two things seem really to be non-commensurable. So it's like comparing apples and oranges. So how do we weigh freedom against health? So this seems to create some problem, and is also the root a lot of disagreement about the extent to which a state can go in limiting my freedom for the sake of public health. However, some people think that freedom and health are actually commensurable because if you think about it, viruses, so it's not, they're not only a matter of health, they're also a matter of freedom because viruses can restrict your freedom. If you get sick, if you get the virus and you get sick, then there are many things you cannot do. So in a way, viruses restrict my freedom in the same way as public health restriction restricts my freedom. And this is an argument that has been put forward in the academic literature recently. So as a reason for limiting individual freedom through public health policy is the protection of freedom itself. So the kind of freedom is threatened from viruses. And indeed, it's an argument that you might have heard often during the pandemic from politicians or commentators. So the next slide, please. So for example, the Italian Deputy Minister of Health at some point during one of the first lockdowns said that having rigid rules today, so limitation of freedom today, represent real liberty, because normality comes with following the rules, and not following the rules is contrary to future freedom. And the idea again is that freedom is temporarily sacrificed through restrictions for the sake of more freedom in the future. So protection from virus that in the future will bring more freedom. Now, the question is, do public health restrictions actually infringe, or can they promote freedom if they keep viruses at bay? So in the long term, enhance our freedom? And the answer is, again, well, it depends on what we mean by freedom, depends what freedom is. Next slide, please. So the notion of freedom, as I've used so far, is a notion of freedom that is typically referred to as negative freedom. Negative freedom was famously defined by Isaiah Berlin, among others, in his essay on Two Concepts of Liberty, as the degree to which no man or body of man interferes with my activity. Kieran Oberman, in the article that I referenced before in the previous slide, he says that negative freedom is defined as the freedom that can only be restricted by external constraints imposed by other people. So if you can complete the slide, please. So this means that it is true that lockdowns restrict negative freedom in this sense. It seems pretty obvious, because lockdowns are interference from the outside by other people with my own activity. But it might also be true that viruses restrict my freedom, my negative freedom, to the extent that viruses are constraints that are imposed by other people, because I catch viruses from other people who are themselves infected. So people act as viral vectors. And so both can be sources of freedom restrictions. If you can click twice, please, Katrin. Just one, sorry. This means that there is a question to be asked here. For example, is something like lockdowns could actually promote negative freedom if they are effective at keeping viruses under control. So if they can promote freedom in the long term. Next slide, please. So question, do viruses restrict negative freedom? Is that true? And if so, do they restrict negative freedom in the same way as lockdowns? Now, there are two relevant considerations here. One is about probabilities and one is about possibilities. Now, which sounds pretty abstract at the moment, but let's see how it works in practice. So next slide, please. So let's think a bit about the way in which viruses can constrain my freedom as a kind of an external constraint on my freedom. So of course, viruses sometimes cause diseases. And diseases, if I get sick, my freedom is restricted. So diseases can restrict my freedom. When you're sick, there are many things you cannot do. Sometimes diseases can kill you. And so when you're dead, there are even more things that you cannot do. I cannot think of a greater restriction of freedom than death. So there is this possibility. So there is this, this might happen. So sometimes viruses cause disease and disease restrict freedom. But sometimes viruses do not cause any disease. I might go to a pub which is full of people who are infected. I might be very lucky and not getting infected at all, and so not get any disease at all. And therefore, my freedom is the same as the one I had before. It's a matter of chance, a matter of luck. Sometimes viruses do cause infection, but sometimes I might be infected, but not having any disease, because many people will be asymptomatic. Sometimes I might have a mild disease, so I will basically be free to do all the things I can do anyway. So the question whether viruses limit negative freedom is really a question about whether my freedom is limited by the probability of getting a disease. Not so much about the virus itself, but about the disease that might or might not derive from me catching a virus. Now, one problem here is that if the mere probability of having my freedom constrained, for example, by a disease, if the mere probability is sufficient to say that viruses restrict my freedom, then this seems like a not use of the notion of freedom, because we will not be free to do many things, because so many things come with the risk of illness or death. Going down the stairs now, if I do that, there is some risk. Driving a car entails some risk. So we don't say that driving a car or going down the stair limits my freedom just because there is some risk that some injury or illness or death will derive. So why we will say that viruses restrict freedom in the same way, if it's just a matter of chance or probability. Next slide, please. Again, please. No, sorry. Yeah, so one question that it is worth asking to see in what way viruses can be said to limit my freedom, even if it is just a matter of probability of restrictions, is to ask, what is it exactly that viruses make less likely? What kind of probabilities do viruses reduce? Next slide, please, now. Thank you. If you can go down. So one useful concept here is the concept of compossibility. So possibilities and compossibilities. So this sounds like a rather technical term, but very simply, compossible means that something is possible in combination. So when two actions or two states of affairs are compossible, it means that they are both possible. Right? It's very simple. So for example, the possibility of going out, say going to the pub, and the possibility of not dying or not suffering from a virus that I caught while going to the pub. So these are compossible actions if both things are possible. So this notion of compossibility of options or actions allows us to distinguish between two types of freedom, so specific freedom and overall freedom. So you have specific freedom when you have individual options that are available to you. For example, you have the option, I have the option to go to the pub now. So I'm free to go to the pub. And I have the option to go to work tomorrow. So I'm free to go to work tomorrow. And I have the option of going on holiday next week. I'm free to go on holiday next week. So each of these things is a possibility and represent a specific freedom. But the concept of overall freedom that we have is about the compossibilities. So it's about how many actions are possible at the same time. For example, if I'm free to go to the pub now and also at the same time to go to work tomorrow and also at the same time to go on holiday the next week. So my overall freedom is greater than it would be if I only had one of these options available, but not the others. For example, if I go to the pub and I catch a virus and I get very sick, I will not have the option to go to work tomorrow or to go on holiday next week. So this distinction seems to be relevant because next click, please, Katrin. Because it seems that when we think in terms of compossibilities, these are a way more meaningful indicator of freedom, because thinking in terms of compossibilities gives us a measure of how many options I can keep open or foreclose by choosing something. Say I choose to go to the pub, but by doing this, I get a virus, I get infected, so I foreclose the other option, which is going to work tomorrow or going on holiday next week. So the notion of compossibility suggests that whatever I choose comes with consequences, and these consequences might undermine my future freedom. So what viruses really do is they make compossibilities less likely. Not so much the possibilities, because if there is a virus out there, I still have the option, so the possibility of going to the pub. What I might not have is the compossibility of going to the pub and staying disease-free and therefore going on holiday next week. So viruses make compossible actions less likely, even if the individual option, the individual freedom of going to the pub is still there, is not modified. Next slide, please. Now, lockdowns are very different in this respect, because look, one might say, well, lockdowns are also a matter of probability, no? Because you can always take the risk of breaking the rules, go out, and then if you're caught, you will end up in jail. But you can still go out and risk incurring legal penalties. If you go out, if you end up in jail, okay, that's a limitation of freedom, the equivalent of catching a disease with the viruses. But it's a matter of risk in both cases. Now, this objection doesn't really work because lockdowns really don't work like that. Lockdowns really make options impossible, not just less likely. So lockdowns are society-wide restrictions, structural restrictions, whereby the option to take risk is taken away. Because in a lockdown, pubs are closed, there are no flights, schools are closed. There are so many things that you cannot do, even if you were willing to take risks. So hence the main difference between the freedom that is restricted by lockdowns and the freedom that is restricted by viruses is the following. Katrin, please, thank you. So viruses do preserve the freedom to take risks. For example, the risk of infection, because the possibilities are there. The possibility to go to the pub is there, even if the compossibilities, going to the pub and go to work tomorrow, are made less likely. But lockdowns remove the freedom to take risks itself. So you don't have the freedom to take the risk of suffering legal penalties because the possibilities are not available in the first place, even if you were willing to take risks. Simply, you want to go to the pub, but the pub is closed. So that's impossible. So that's a way in which virus and lockdown restrict freedoms differently. Next slide, please. So it is worth looking at the way risks affect our understanding of freedom and how viruses, freedom, and risks are related. Next slide, please. So one might say that, as I said before, well, I am free to take the risk associated with viruses. So in a sense, viruses don't really remove the freedom I have to take risk, the option to go to the pub. Really, it's up to me. So even if the possibilities are less likely, the possibility, so the freedom to choose one option, say going to the pub, is unmodified. Viruses don't change that. I'm free to go to the pub and to risk. Well, one might say, well, not really. What if the risk is very large? So for example, what if instead of COVID, which is still quite a risk, of course, what if there was an outbreak of smallpox, for example, say some bioterrorist attack? So smallpox comes with 1 in 3 chances of death and with the risk of severe injuries for survivor. So one would say, well, there is an outbreak of smallpox out there, but you're free to go to the pub, really. I say, well, in a sense I am, but in a very, very important sense, I'm not. So I will be too scared to go to the pub, and probably rightly so. So there is a different kind of freedom. That is the freedom that you have when you live in a society or in a place where there is some level of security, so it's such that you have some freedom from fear. So you are not dominated by your fears. You can make your own decision without fears interfering with that. Next click, please. So freedom from fear and this kind of level of security is an element of what, again, Isaiah Berlin calls positive freedom, or the freedom to do things, in his famous essay on 2 concepts of liberty. And the main difference is that negative freedom is thought to be the freedom from external constraints, as I said before, but positive freedom, or the freedom to do things, is the freedom that I have when, so to speak, I am my own ruler. So I have this kind of autonomy. So I'm not ruled by fear. Now, the debate about the nature and the ethics of positive freedom is way more complicated than this, of course, and I'd be happy to answer questions about that. But for the purpose of making this point, this should suffice. So I have positive freedom when I have the autonomy, I make my own rules, and I'm not dominated by fears. Now, one might say that lockdowns promote freedom from fear of infection, for example, whereas viruses, especially serious viruses that come with the risk of serious disease, undermine positive freedom. So one might say that the freedom that viruses undermine is not really the negative freedom, like lockdowns, but is the positive freedom that I have when I don't feel safe. Next slide, please. So as I said, this is the freedom that comes from feeling safe. So from feeling secure. Security can be defined as a stable, relatively predictable environment in which an individual or group may pursue its ends without disruption or harm and without fear of such disturbance or injury. Next slide, please. Now, this one between, yeah, you can show the thing, please. Just another click. Thank you. Stop. No, back, please. Yes. So this distinction between negative freedom and positive freedom is tracks a politically relevant distinction between, so negative freedom is really associated often with those who believe in the minimal state. So with the political view, which you might call the libertarian view, for example, famously defended by Robert Nozick, for example, whereby the state is not justified in intervening to help or protect people, except to protect individuals against undue force, fraud or theft. But if you endorse positive freedom, if you think that the state should pursue positive freedom, then you're likely to be more in favor of active state intervention, including in the public health domain, in order to reduce the risk for people. So you think that the justification is stronger for the state to limit the freedom, the negative freedom of some, in order to make the environment safe for everyone. And this tension between negative freedom and positive freedom, and therefore between libertarian views and more, you might say, maybe politically left-wing views, has been really a big feature of the debate during the pandemic. And of course, these are the two extreme positions. There are positions in between, but this is kind of the spectrum, the political spectrum that negative freedom and positive freedom track. Next slide, please. Now, one might say, well, it might be true that viruses undermine positive freedom because they make people feel less safe, and it might be true that the state has some obligation to protect positive freedom. I don't know. But really, we shouldn't really get rid of the idea that viruses do undermine negative freedom as well, just because they're a matter of risk. Because, in fact, many things that we do consider limitation of negative freedom, including state policies, state intervention, state restrictions, are also a matter of risk. So the case of lockdown is an extreme case, because with lockdown, many things are made impossible. But that's an extreme case. Normally, most restrictions, including public health restrictions, come with the risk of penalty, say, risk of a financial fine, risk of jail time, for example. So take, for example, some of these pandemic policies. You might remember the rule of 6, mask mandates, vaccine passes, and beyond the pandemic, beyond infectious disease, things like smoking bans, no drug policies, no drink and drive. So these are all things that we would say limit my negative freedom because the state intervention, external intervention, and constrain my freedom. But they are also a matter of risk. If you're lucky, you can get away with any of these things. Probably many people during the pandemic got away with, certainly with the rule of 6, for example, because it wasn't really properly enforced. So if these are also a matter of risks, so then one might say, then it's the same case with viruses. So maybe it is true that viruses and public health restriction constrain the same type of freedom after all, because they're both a matter of risk of future limitation of freedom. If I break the rule of 6, I might go into jail. If I go to a pub where there's a virus, I might have to stay in bed 1 week. They're both a matter of risk. So it makes sense to try to frame them both in terms of negative freedom, maybe. Next slide, please. So here is, in summary, so the idea is that both risk and threats of penalty reduce overall freedom by reducing the chances that possibilities are available to us. In the case of public health restriction, there are risk of penalties. And in the case of viruses, there is a risk of illness or death. Next slide, please. Now, if you can, okay, stop here, please. Yeah, that's fine. Okay. The question is, if it is true then that risk reduce freedom, now I'm a bit confused because, as I said earlier, that everything comes with some risk of future freedom restriction. So it seems that everything really can restrict my freedom. Take the following example. Driving comes with the risk of accident, injury, or death. Taking the tube comes with some risk of terrorist attacks. There is some risk, and that will be quite a limitation of your freedom if you die in a terrorist attack. In this country, interestingly, as I learned recently, that if you put a stamp upside down, that's a crime, and you risk going to jail. Now, would you say that driving or taking a tube or putting a stamp upside down restrict your freedom just because they come with the risk of possible future freedom restriction? Well, I would say no, that's not how we use the notion of freedom. So why is that? And it seems to me that one option is that maybe because here, the risks we are taking are considered normal, acceptable. So these are the risks that are part of our everyday life. So we wouldn't say that this possibility of future freedom limitation limit our freedom, especially so in the case of putting a stamp upside down, because this rule is really almost never enforced. No one will come to your home and check whether you put it upside down. Taking the tube, the risk of terrorist attack is very small, and the risk of car accidents are relatively small. But if we think of other cases, for example, Catherine, please, next 3 points. Viruses, lockdown, or other public health restrictions, to come to things relevant to public health policy, do they restrict freedom? Well, I would say by the same token, depends on whether the virus is acceptable. So lockdowns, click please, certainly restrict freedom because the limitation of freedom is certain. But both public health restriction and viruses, whether they do restrict freedom, it seems to me depends on whether the risk of future freedom limitation that come with them is acceptable or not. And there's a big question mark. It depends on, I would say, it depends on what kind of virus we are talking about and what kind of public health restriction we are talking about. For example, I said before, did the rule of 6 restrict people's freedom? It seems to me not much because that rule was very poorly enforced, perhaps with good reason, I don't know. But if the risk of suffering a penalty is very low, then maybe it doesn't make sense that your freedom is restricted. But if the penalty is very high, maybe you will say your freedom is restricted. Next, please. There are 2 question marks. Yeah. Now, you can click again the next one. Thanks. So from what I said so far, it seems to me there are at least 2 ethical and political relevant distinctions that we have mentioned. One is the distinction between the risks that are posed intentionally and risks that occur naturally. So to some people, this distinction is relevant. Public health restrictions are limitations of freedom that are posed intentionally by some state authority, whereas viruses are limitations of freedom that are posed unintentionally. They just happen. So outbreaks naturally occur. And even when you're infected by people, it's not that people intend to infect you. They just accidentally happen to infect other people. So this distinction, to some people, is ethically and politically relevant. And then there is an important distinction between freedom and liberties, which I haven't mentioned yet, but that's an important distinction to some people. Some people use these two terms differently. So freedom is a matter of how many options, how many possibilities or compossibilities you have, how many options are available to you. Liberty refers to some rights that you have on others, some claim rights on other people. So liberties are about your right, your freedom as a matter of non-interference from other people. So public health restrictions sometimes restrict your liberties, like lockdown restrict many of your liberties, freedom of association, freedom of movement, whereas viruses only restrict your freedoms, only limit your options. And to some people, again, this distinction has political and ethical relevance, because to some people, it makes a difference whether my freedom is restricted by some natural phenomenon, unintentionally, to refer to the previous distinction, or whether it is restricted by some authority. Again, there is a right and left divide on this, but there are all sorts of ethical positions that treat these two kinds of things differently. So these are another thing that might make a moral and political difference when we assess public health restrictions. Next slide, please. I'm very conscious of time. Now, let's complicate. These should be the few final slides. Let's complicate things even further. So far, I've talked mostly about negative freedom and positive freedom. But this understanding of freedom as non-interference from other or from the state is a relatively recent notion of freedom in human history. So for most of human history, people have talked, have debated, and have defended a notion of freedom that is what I would call democratic freedom. And that will be freedom from, not so much from state intervention, but from intervention that is oppressive, from some authority that doesn't enjoy some kind of endorsement from the population. So democratic freedom is the kind of freedom that you will find in the literature, with exception, at least up until the 17th, 18th century. Now, one problem is that, of course, next slide, please, negative freedom and democratic freedom, which are both legitimate and important notions of freedom, can be in tension with one another. So you might have heard the expression the tyranny of the majority. So sometimes democracies can endorse policies that are oppressive towards certain people, that violate some people's rights. And that is why often democracies have constitutions that protect basic rights. But in principle, there is a tension between negative freedom and democratic freedom. There can be. Now we can skip this tip about Hobbes. Next slide, please. We have seen this during the pandemic, for example, where I will not go through the examples here, but many democratic countries, democratic government, enforce policies that were really infringing upon negative freedom of people. But many of these policies enjoy the democratic support of the population. Many tight restrictions were, at least at some point during the pandemic, democratically endorsed by the population. So my negative freedom, my civil liberty sometimes are infringed upon by a state that, however, enjoys democratic support. So in a way, I don't have the negative freedom, but I do have the democratic freedom. And this tension that, again, creates problems and debates when it comes to the ethics of public health policy and public health restrictions. Next slide, please. I believe this is the last one. Again, 1 point, thanks. So to conclude, when it comes to the ethics of restricting freedom in public health policy, there are, at the very least, from what I said so far, 3 relevant considerations that you might want to take into account. One is that there are different kinds of freedom involved, and people will disagree about the relative importance. We have seen negative freedom, positive freedom, and democratic freedom as the relevant types of freedom involved in public health policy. There are more types of freedom, but we only have half an hour. And the other relevant consideration to determine whether my freedom is infringed and to what extent is how probable it is that compossibilities, so option available together, will be undermined. So when is certain kind of risk normal or acceptable? Where is at a threshold after which we can meaningfully say that my freedom is reduced? And also it's important, there are different ways in which freedom can be restricted by viruses and by public health policies. So some restrictions are intentional, some unintentional. And depending on where you sit on the political spectrum, this distinction might make a difference to the way you assess public health policy. And next, please, because this should be the last slide. Thank you very much. I appreciate you staying here despite the technical issue.